is an exclusive presentation of Cablevision local programming. TV that's close to home.
Spinal stenosis is a condition in which the spinal canal narrows and it presses on the nerves. This can cause back pain and numbness.
But today on Health Talk, we're going to tell you about a new FDA-approved clinical trial that may help people suffering from this condition.
Stay tuned. Health Talk is coming up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today on Health Talk, we're going to talk to orthopedic surgeon Dr. Robert Brady about a new research treatment for the treatment of spinal stenosis.
Dr. Brady is the principal investigator of this trial, and Norwalk Hospital is the only hospital in the state of Connecticut that has been selected to participate.
Welcome to Health Talk.
Thank you, Eric.
And we've had you in the past talking about a novel device, so I guess we're going to talk about an even more novel device for the treatment of this. But let's go back to the beginning. What is spinal stenosis? Who gets it? What does it feel like?
Well, spinal stenosis is a degenerative condition of the spine where it's affected by arthritis, where you get the ligaments get bigger, the joints get bigger, the discs start to bulge, and all this narrows the room for the nerves.
It's kind of amazing because it's not intuitive. When the spine gets irritated, it actually creates new bone, doesn't it?
Correct.
And the new bone isn't really normal. It starts to crowd out important things.
Yes, absolutely. And so with this narrow room for the nerves, it can create pain for the nerves. So people usually present with some type of pain or numbness or weakness in their legs that is typically exacerbated with standing or walking. And usually patients with stenosis say they feel better with sitting or bending forward because that helps to open up the room for the nerves.
It's pretty classic, right, that
Correct.
Patients may feel back pain or leg pain,
Right.
even sometimes calf pain if they're walking a lot, and the folks who feel better when they lean over a shopping cart,
Right.
that may be a sign that what's causing their pain is spinal stenosis.
Yeah, absolutely.
A lot of people have heard of claudication or peripheral arterial disease, and I know that spinal stenosis often gets confused with it. Why do we get confused?
I think that the symptoms are very similar. However, people with what we call peripheral vascular claudication or claudication from the arteries, they typically don't necessarily get better with just sitting or bending forward. And they usually have some other conditions. The pulses are lower, but if they're of a concern, we always have them consult with the vascular surgeons as well.
Yeah, they're two very different causes. I think in one instance, there's not enough blood getting to the muscles,
Right.
and that's causing the pain. And in spinal stenosis, it's actually pressure on the nerve roots
Correct.
or on the spinal cord that's causing the pain.
And there's a small percentage of patients who have both, so it can be quite confusing.
Who gets spinal stenosis?
I mean, it can happen in any population, but it's typically patients who are over the age of 50 who have some type of arthritic condition of their spine, but it is common in all populations.
So the symptoms the patient should look for are what before they go see someone?
Again, most of the symptoms are related to the narrowing of the room for nerves, or predominantly lower extremity symptoms: buttock pain, leg pain, numbness, weakness, sometimes heaviness in the legs. They can have back pain, but the back pain is typically not predominant. It's mostly the lower extremity symptoms.
And as you said, it's often relieved by bending forward
Correct.
or sitting down and leaning forward.
Correct.
And it's important too, I think, to mention that because you are having nerve compression, some people do have, as you said, numbness or even weakness.
Right.
So it can be more than just a nuisance.
Right.
It can be something that really causes some problems.
Some people can, a very small percentage of patients can have a neurological deficit related to the narrowing. Very uncommon, but it can certainly happen.
Now, what was the old treatment for spinal stenosis?
Well, the gold standard treatment for stenosis is something called a laminectomy, and that's where we remove the bone and ligament and open up the room for the nerves directly. There are small.
That was a big operation, wasn't it?
It's a relatively big operation. There is a percentage of patients who have instability, who we actually have to do combine the laminectomy with a fusion to create stability, and that's a much bigger surgery. But with the advent of technology and spine surgery, we've gone to this, we've learned that less is more, and so we've done more minimally invasive procedures, and that was with the advent of these interspinous process implants.
And I think you were on about a year ago talking about the X-stop, which was an interspinous process that helped, but now there's a new one. Before we get onto the new one, maybe you could show us with the model how the placement of an interspinous, what the interspinous space is,
Sure.
and how the placement of a device there can help the spinal stenosis.
Sure. Again, spinal stenosis, the typical patients, they describe pain with standing and walking, usually better with sitting or bending forward, and that sitting and bending forward position helps to open up the room for the nerves. So there are surgeons in San Francisco who 4 or 5 years ago drew on a napkin this implant that they would put in between the spinous processes of the bone. As you can see, this is the main room for the nerves here, and then you have the individual nerve roots that come out here.
So the spinal cord in this device is actually the blue central material that people are saying, and the nerves are the blue tails coming out.
So where people get stenosis is these joints get bigger, the disc here starts to bulge, and this room for the nerves gets narrowed. So what the people do to get better is they help to open up the room for the nerves by extending or bending forward. So simply the implant just goes in between the spinous processes and just helps to keep that room for the nerves open.
It seems like one of those things that is almost so simple that once people thought of it, they must have said, why didn't we think of this sooner?
Absolutely.
And so we actually found that something that was naturally adaptive, what you're doing is replicating that leaning forward position for those particular disc spaces or spine processes all the time.
Yeah, and the benefit of this is that you're not removing any bone, you're not removing any ligaments, you're not opening up the spinal canal, so there's no risk of injuring the nerves, and so it's just much less invasive, and you're not burning any bridges. And if the implant or the procedure is not 100% or doesn't offer them enough relief, you always have the gold standard to turn back to.
So you can still go and get the bigger surgery if this doesn't work. That's really important for people to know.
Yeah, and to be honest, when they invented this implant, that was the goal. This was supposed to be an interim between epidural injections and laminectomy. And what we found is that 3 or 4 years after the surgery, patients are still doing well, and so we've had to revise very few of them.
It's really amazing that it lasts that long. Just that little bit of extra space gives the nerve enough room, so it doesn't give you a problem. Yeah. Now, again, when you were on before, the device required incisions on both sides of the spine, and tell us a little bit about this new device and why it may in fact turn out to be a lot better.
So again, our goal is to be less invasive. So with this new implant, again, it's a single implant, whereas the previous X-stop is 2 implants that we have to put together during the surgery. We're able to take down the muscles on only one side of the spine instead of both sides, so we're able to maintain all the ligament and muscles on one side of the spine. And as you can see, this implant is made of a plastic material. It's a special plastic material called PEEK, and this is closer to the density of bone as opposed to the titanium implant of the X-stop. So our goal and our theory is that this implant can cause less trauma to the patients and achieve the same goals of the X-stop.
It was interesting, before the show you were explaining to me that the importance of it being closer to the density of bone is that lots of times folks with spinal stenosis are older, and they may also have some degree of osteoporosis.
Yes.
And so you'd like something that is light enough that it doesn't have risk of injuring bone on either side of where it's placed, which I think sounds really important.
Yeah, osteoporosis is actually a contraindication to X-stops, and really in the FDA trials, a contraindication to this implant. Mm-hmm. But our theory is that with the closer density of the bone, that we can offer this to older patients who have weaker bones.
And tell us about how you use the devices here that you brought with you.
Yeah, this is we like to keep things simple. So there's really just 3 or 4 instruments in the tray. You make your small incision on the right side of the spine. You take this implant, which just helps to create a hole in the ligament between the bones. And then we use another implant that just makes the hole a little bit bigger. And then we put a distracting instrument in here, and we just help to open up the room for the nerves. And then we use a trial implant to make sure that we get the right size, and then this is the last implant that we put in.
So are there different sizes of the implants?
There's different sizes of the implants, correct.
Now I know that I'm sure this device itself hasn't been priced yet, but these devices, in fact, are pretty pricey, aren't they?
Yeah, I mean the implants themselves can be expensive. However, with with the market as it is, they try to bring the cost down to similar as it would be if a patient needed a laminectomy or a laminectomy infusion, so we don't have to increase any real healthcare cost.
But that's great. And what kind of results have you seen with this so far? You're participating in this trial of this new device. What is it called again?
This particular implant is called the Flexus. It's made by Globus Medical company. We're just enrolling patients now. We were just selected for the FDA trial. We're one of only 20 nationally, and we're the only one in Connecticut and New York that is FDA approved, or that is selected to be in this trial. The goal of the implant is to help to really or be similar to the X-Stop implant.
So if somebody is interested, who has spinal stenosis and is interested in this, they can contact you directly at your office?
Correct.
Is that right? Well, we're going to bring in a patient in the next segment who did contact you, who has had this device, and I think has had a fabulous result. We'll be back after a short break.
Don't go away.